just to start with, I just wanted to touch upon 2 points which was taken in the previous session by Joy. And since I have also been working on sexual harassment at workplace quite a bit, one of my experience has been that a lot of the cases that happen are also unintentional in a lot of situations. It is not intentional, it is unintentional. Why? Because Joy cited the case of that expat, you are making a comment and you don't realize that that comment is offensive to the other person. Because for you, that's your way of functioning, You have grown up like that. No one has ever told you that what you're saying or doing is not right. Could be offensive to someone else. But when we come to a workplace is of varied people coming from different cultures, different backgrounds, different upbringing. One very, very famous case which I cite is, I think it was Richard Gere who came in a Coca-Cola event, and he publicly on stage hugged and gave a kiss to Sushmita Sen. And Sushmita Sen filed a case against the actor. Was it right or wrong? Your thoughts? Yeah, that's how you greet, perhaps there. But is that acceptable here? No, that's not our culture. She said that as per Coca-Cola contract, I was not expected to give a kiss on stage or get a kiss on my cheek, not on my lips definitely. But even that, but as a professional, is it not his responsibility also? So ultimately, he was penalized. But that is what I am saying. It is out of ignorance. And that is why I am saying. But even for his culture, how far it is alright is again debatable, because in a professional setup, if you are not close, the intimate space for a person, sometimes even I have also this habit of hugging people when I meet, but sometimes even a handshake can be a problem. When I went to Afghanistan to work, I had to cover my head every time I walked out. That's their culture, I have to respect it, otherwise I will not be able to work. I have not been asked to wear a burqa, but I have to cover my head if I have to work. So I think that's the whole thing of ignorance. Many a times, that is why what Joy was saying, to ask your departments to hold these training programs. It's very important both for men and women. Both sides, because even we don't want to lose good co-workers, friends. I had a very close friend who had this habit of pulling ears like this. He would do every time. Ma'am is already going like this. And we were a group of quite close friends who joined, and also those who joined became good friends and was going on. But then this new lady joined us, and he unintentionally would again go and do this to her also. In his excitement, that's his way of doing, hey, aisa karke he'll come. And when he did this, she first time said, please don't do this, I don't like it. But because it is his nature of doing that, he forgets and he goes and does that. The third time, she gave a written complaint and it went against him. It went in his personal file. I being in the committee, I could not help it, knowing that he has not done it intentionally, but I cannot help him. At that point of time, sitting in a quasi-judiciary position, I have to make a statement which is not acceptable, because if someone has told you that the person doesn't like it, you cannot repeat. Workplaces, we want to make safe workplaces. For the professor, massage de do bacha bolke, I thought she is my daughter giving massage. I have not sent my daughter to give you massage in the university, sorry. I have no bad intention, my daughter also gives me massage, is what we get to hear. Is it okay? Is it acceptable? It has been happening, all batches have done. I have so many daughters, call my daughters and ask them. So, I think this is what I am saying, is that we need to talk about such issues. We need to make our children aware, because we are now working in co-inhabited spaces, whether in our communities, whether in our workplaces. We are sending our children outside. So, I think we need to be very, very conscious on this element, and a lot can be done. Okay. So, we are doing the last session today of planning and budgeting. Can you just guess the age of this person with me? The one, that was me when I was a little earlier, a few years earlier. This is in 2017 or 18, 17. So, this young kid, what would be the age? 15? Anyone else wants to guess? She is a 27-year-old lady. In South Garo Hills, that I met in 2017. So, when we do our planning, we should think about the last person out there. We don't want to miss anyone in our planning. We don't want anyone to be left out. We don't want that 9-year-old kid, for whatever circumstances to be. We want a society which is fair, safe, and just for everyone. So, the principle and ideology should be that for our work. So, ensuring that the services and assistance provided is planned and implemented in a way that benefits women and men equally, taking into account their needs as well as their capacities. So, that's what planning is all about. It is important because of keeping, why are we talking about gender sensitive planning? We make plans which we don't consider sometimes. We consider the community as a whole and a union and don't differentiate. We have a poor community. Fine. And we are going to make economic policies for improving the economic condition. Now, when we make that planning, are we taking into consideration the different variables that are there for each of the groups that are part of that community? And that needs to be thought about. So, it is important that women and men's specific needs, and those are need to be thought about. Like women go through a reproductive process, and that reproductive process has a huge impact on their health, and because of that impact on their health, how their children will also be a result of their health. If I as a mother am not eating well, I have anemia, my child will also be malnourished. And if my child is malnourished, what is happening? The developmental growth which should happen does not happen appropriately. So ultimately it is impacting the entire community. So the vulnerability of the women and the mother, which needs to be kept into mind while making our plan. Gender roles and their capacity should not be based on stereotypical perceptions of roles, strengths, abilities. Each group needs to be harnessed. Strengths of each group needs to be harnessed. So again, there is this element of how do we go beyond stereo. And sometimes when we are planning, we can be ambitious and introduce newer things, like we saw yesterday. We got this opportunity to do something different, to make a program which is different, and we try to do something different. It changes, like training the girls on instruments. Yeah. So again, trying to change the power relationship that affects their respective abilities to access support. Do we have reservation of seats in the buses in Meghalaya for women? We don't have here. No. Yeah. Like if we see in our most of our places, even in Assam, because our sex ratio is not the same. No, women are lesser as compared to the number of men. So there in a bus when you get up, and we don't see as many women in the workforce perhaps as here. So there is a reservation that, because otherwise they will never get seats for the bus. A woman will have to stand and go, and men will be sitting. So there is the government policy for a reservation of the first 4 seats for the men. Similar for persons with disability. You know, the first parking of places you will see which is closest to the door will be reserved for wheelchair bound people, so that it is easy for them to access. Yeah. So there are requirements to understand that you need sometimes to have these kinds of provisions laid into your planning, so that the access is better. And again, women and men bring different issues to the table. At every stage of planning, there has to be engagement, because what I experience will be perhaps different from what you experience and someone else experience. And everyone's experience and ideas can contribute. So there has to be at least substantive representation of each group on a table when a planning for a process is happening. You know, Delhi can plan everything for the entire country. Why are states required? Why are districts required? Why are village councils required? Because there is a need for representation of the people themselves to be able to articulate what they need. I think that is where it is very important that we acknowledge that there are different concerns, different perspectives, different experiences to solutions that people can bring, and that is why it is important for them to be a part of the planning processes, not only receiving process. Even in the planning process, their role is very important. And that is why globally it is being said that women's representation in decision-making platforms is important. And like what Joy was mentioning again sometime earlier, that even women are saying we don't want to be in doorbars, we don't want to be in, we are happy giving our suggestions in the kitchen while I cook. You listen and you go and tell. But again, the whole thing of equality comes from the right to choice. We also need to think from the entire community of each and every individual. Are our children going to think the same way as we are thinking? My mother-in-law, who's a Khasi, I'm married to a Khasi, she also says, women don't need, are not required because their issues are being taken care of. I acknowledge that. But what? Our children are getting more educated, they are getting more exposed, they know much more of the regulations. Will they be happy talking about their issues from the kitchen, or would want to also participate in the sitting room as equal counterparts and discuss issues from their perspective and not be represented by someone else and think that their thought processes are going to be represented well, or what they think? So I think these are things as a community we need to discuss and see what are the options, because it is a transitory phase also, and in these many times when there is a transition or a change happening, there is resistance, right? And when there is this resistance takes very, very different forms. And we need to be conscious about that. I'll again like to take an example here. Everyone knows about the Nirbhaya case in Delhi, the rape case which happened. I don't know, some of you might have also seen, there was a BBC documentary which was taken for the rapists in the jails. They were taken interviews in that documentary, and one of who was a juvenile still, that young boy, the way he spoke in his documentary, like what Joy was saying, that their father was non-repentant about raping his 5-year-old daughter here in Khasi Hill. It just came back to me that I had seen that video, and the way that boy was saying, nowadays women go out, because that girl came out late in night, she was in the streets of Delhi, she needs to learn a lesson. And to teach women a lesson, I did this. So you start justifying yourself of your action. And this is very, very important to understand, that when there is going to be resistance, the resistance would come in a very violent form also at times. So the violence, because somewhere the equilibrium is not there, men and women. So I think there is a need for introspection, more dialogue, more discussions to see how do we bring about that equality and equilibrium. And that is why it is very, very important for policymakers, for people in government offices, to have the gender lens. Like what Joy was again saying, going to a police station, I am coming, going to a commission, I am coming with an expectation of a decent hearing of my grievance. And if the person there is not sensitized enough, is not aware enough, then the response might be very, very detrimental and will then lead to more people not coming forward. So that is where gender lens is very, very important and has to be kept in mind through all stages of scheme development and delivery. While you are preparing your schemes, you need to think, is it going to be equitable for that last girl in somewhere down in South Garo Hills, in a remote village, in some of the circumstances that we heard the first day in our case study? Is it going to also benefit the person there? Thinking that and seeing how it is going to bring or push towards gender equality. Enables us to meet the needs and priorities of the population in a more targeted manner, keeping in mind underlying gender norms and inequalities. So, we should be also thinking about, when we are talking about our schemes, we should be knowing what is this scheme trying to address, and not that just we need to roll out another scheme or policy. And is it meeting the national and international standards? Today, this context is very, very important, because there are standards being set, especially the UN standards, I would say, because India is a signatory, is a member state. We have to be responsible to international standards. Ensure that the people are acknowledged, that all their needs and vulnerabilities are being taken into account, and facilitate and design of more appropriate and effective schemes and programs to ensure equitable access to both women, girls, boys and men. Like I said, every person should be able to access. Suppose I have a relief distribution. There is an emergency, I am setting up a relief distribution. You know, we did a lot of relief work during COVID. And that relief distribution is being done centrally, and people have to come and take the services from that location. And we thought, okay, let's make it women specific, so only women have to come and take. Now, if the ration package is heavy and is distant, will all women be able to come and take? No. Participation will be low. So, when we are making the schemes, we need to think, the guidelines that we are setting, are they applicable? Again, Joy talked about section 19. Whether under POCSO, the declaration of section 19 is applicable to us or not. If not, then do we need to amend that in our state rules? So, you know, everything we should start looking at the point of access, whether it is going to deter someone from accessing the plans and the schemes that we are doing. And we can take examples from our own work fields, like Women's Commission. Being the counselor, if the counselor is not trained or is not there on all days of the week, like you yourself said, that you are a part-time, so it's not all days of the week that you are there. Many a time your clients will come, they'll go back and they feel that, okay, we don't meet the counselor, we don't get to see. So, we'll have to think from the woman's perspective of how do we encourage them and make them feel that they are being heard. So, for everything, we need to look at it from those lens, and when we are also then raising our proposals, we should keep all this in mind, because then it will be understood better. I just keep writing that I need, we should put a counselor full time every day, but we are not writing reasons why. We will not allow that past to be processed well. And when we are able to put it up in the perspective of why and how it is going to be effective for the last mile, that's when people understand and take note, because there would be so many issues there. This is a small framework that we normally use in our development work for making projects or schemes which we say as adapt and act framework. So, any project we look through this lens of analyze gender differences, design services to meet the needs of all, access for women, girls, boys and men, participate equally, give space, and it, when I am saying participate, right from the planning to the end, delivery and auditing, how will all the stakeholders participate, train men and women equally. We make sure in all our training programs, we say that 30% women, 35% or mostly 50% women should be there in the trainings. Because in many of the other states, the women's participation is low. Nowadays, of course, with the SAGs, a lot of participation has increased. We get a lot of women's participation. But when it comes to very technical trainings, then again we see that they miss out. Address GBV in sector programs. Again, gender-based violence, like we said, is not only about physical violence, but any form of violence. So, within our programming, we should be also conscious to make sure that there is no GBV. There is a lot of exploitation which also happens in the delivery of services. The quid pro quo which Joy was mentioning happens. I will give you this scheme, spend one night with me, even in rural areas. You want to say something? Yeah. So, I think it is very, very important why we should have. So, here again, sexual harassment at workplace policy has to be talked about across board, right from the bottom top, because whoever has power, whoever has resources can use it wrongly, no? The power dynamics, till that whole consciousness of equilibrium, respect, justice has been instilled in everyone, we need to make sure that we are addressing such issues. Collect, analyze and report sex and age disaggregated data. Again, in today's context, it is very, very important whatever we deliver right from our planning stage, we have disaggregated data. Today is the world of data, no? Everyone keeps on asking, ye data, wo data, give us how many children, how many girls, how many boys, how many which district. So, very, very important to make sure in our planning phase itself that we have this system to collect, analyze and report. Target actions based on gender analysis. Coordinate action with all partners. So, we should also take all our stakeholders in while in the planning phase. We should make sure that we are calling different stakeholder groups and understanding their perspectives. So, that's the concept. We could have taken a few examples, but because of the limitation of time, we will not get into the details of it. But you all can further read about this online also. So, we will move on to next section of, we make a lot of schemes, plans, but we also need to have substantiated resource allocation for it, because without the resources, the scheme will not be implemented. And that is where gender responsive budgeting is required. That our budget is responding to gender needs of our community. So, what's GBR? It is an analysis of the budget from a gender perspective. Disaggregation of the budget in terms of its impact on men and women. Highlights the gaps between policy and resources committed. So, many a times we have heard a lot of governments saying, yeah, we do a lot of programs for gender and everything is being taken care of. And then when we start looking at the allocation, that will be very, very minimal. But till there is no, if there is no specific allocation for it, how do you make out from a clubbed budget as to what is there for women and what is there for men? In the state budget, you must have seen how huge a document it is. In that, to find out what is it for women is very, very difficult. And it is done at all levels, national, regional and local levels. So, it is not a separate budget for women. It is not that there is a separate budget for women. The state will make a state budget. This is an annex to the state budget, an annexure which they say that of the schemes that are there in the state budget or the national budget, this is how we are segregating. This segment is for women. That is being brought out. And it is not about this year's Meghalaya government last year has done its first gender budget. It is not that only last year Meghalaya government has spent on gender, earlier it had not. All these years it has been spending. It is just that it did not bring out a separate data as to which are the specific schemes for that. That is it. It is not, it is giving additional money now, or it had not done so earlier. It was not spending for women earlier. It was. It has always been. But showing it differently. And it is also being said that this is not only the just making a budget is not the end. What is more important is the delivery of it. One of the benefits is that promotes gender transparency and accountability. When you have a specific budget, you know what is there for the women, and it is, then you can check whether that is being spent, not spent, why it is spent, why it is not spent, and it increases the transparency and accountability. Addresses discrimination, inefficiency, corruption, more effective use of public funds, improves policies and contributes to economic growth, strengthens citizens' advocacy and monitoring. Now, budgets have also always been a public document. No, it is always available online. Earlier also you could access that by going to the department and asking for it, which was much difficult. Now with being online, it is always. But even reading a state budget and from there identifying what is there for women is not a very difficult task. Even people like us who have been doing it found it very, very difficult. So, creating this separate document gives citizens, common citizens, a much more knowledge on what is allocated for women specifically. So, what is the goal of gender responsive budgeting? It's about raising awareness of the gender issues and gender impact of budgets and policies. So, this is a part of the SDG, and internationally, globally, this practice is being followed now, and it is pushing more and more governments to do this because it helps raise awareness on gender issues and gender impact of the budget and policies. Because I have started this scheme and utilized this much money, this has been the change. It is more efficient way of stating what is the impact the government is making. Hold government accountable for budgetary and policy commitments. We will make our state safe for women. How? What are the things, any idea, what are the things that the government can do to make the state safe for women? Any thought? What is one strategy you would like to propose? Or maybe even making Shillong safe for women? Any one suggestion? Any suggestion? Street lights, great. Yeah. If localities are dark, women feel afraid to go out in the night, and there could be cases of assault for a woman. So, if it is lighted, the chances of assault goes down drastically. But to erect street lights, what will be required? Budget, money. Yeah. So, only if the in the state budget a line comes, street lighting in the city of Shillong, this much is your budget allocation, only then the work will happen, right? Otherwise, manifesto remains a manifesto. So, manifestos, promises, many happen but don't get implemented till it comes. Once it comes in the budget, even the department will be, because they are answerable, even if they don't do the work, then they will be say underutilized budget, usme bhi question. So, you are then under a pressure to perform also, no? That is why GBR is a very, very effective means of gender empowerment. Because it puts a lot of things under pressure. Statement is statement, no. They say, then the department, we never got money. How will we work? The government will say, oh, allocation did not come. How do we make a scheme functional? We promised, we wanted to do it. Everyone will throw the buck at the other. We didn't have money to do it. But once it comes here, then it is very difficult to say, or there will have to be really very, very strong reasons to say why they could not do it. And thereby promotes gender equality. Now, what are the requirements? The requirement is basically gender knowledge. Now, gender budgeting is whose mandate? Whose mandate? No, who makes this gender budget? The government. Which department? Planning. You don't know, you are assuming planning. Planning makes? No, planning doesn't make gender budget. Who makes gender budgets? Huh? WCD. Finance, WCD. Planning. Yeah. So, for even to finance or WCD or planning, unless I don't have a gender understanding, will I be making a good document? No. So, the first requirement is to understand gender. Second is to have budget knowledge. Only those who are making the budgets will know how to make a budget, no? Yeah. Or the people who are responsible to know how to read a budget, like the planning department has to read every budget of all departments perhaps. So, you have to have a basic knowledge of budgets, and I think it is very, very important. Today we are also teaching children how to, because nowadays even child budget, Assam, I was a process of the child budget development. It's so interesting. We made the child budget child friendly, and we took it to government schools. What an experience of doing that. The way children started reading the budget and throwing, oh, hum log ke liye cycle hai. The girls are so excited. We're going to get cycles. I have to do better because I want to get the cycle. It gives them a different form of motivation. They will know, but when they have seen it in a legal document which is coming to them in their school, it's a different form of excitement. Issues sector specific knowledge. So again, sector specific knowledge. Why are schools girls dropping out? Especially in Assam, rural Assam, like we saw the same thing of the cycle. Right. Schools are at a distance. So after middle school, high school becomes difficult because they have to go further away. So higher education, young girls drop out because they cannot go. They don't have enough money and things. So we need to understand the sector, and each sector, whether it's education, health, agri, the sector understanding is important of how you will push gender equality. What is the enabling environment required? Access to budgets, availability of gender disaggregated data. This is very, very important, and that is where this is again something which all departments know how much important today data is, and keeping records from a gender disaggregated dimension is very, very important. Awareness of the needs and benefits of gender responsive budgeting, the political will to do it. This is, in many states, this is seen as additional work. and that is why governments are also reluctant to push it forward. So I think if we start understanding the benefit of it, then political will also increases, and also awareness of politicians of seeing it, how it can help in better showing what they are doing for the women in particular, because gender budgets are largely around women. And then citizen support and clear objectives and adequate resource allocation. Like what I said, this is also mandated under the SDG. Yesterday we saw the SDG goals, right? So SDG 5.c, the indicator talks about gender budgeting. So it is mandated not only for India, not only for Meghalaya, but for the entire world who are signatories to the SDGs, that they are doing this, and it is saying that all member states to adopt and strengthen sound policies and enforceable legislations for promotion of gender equality and empowerment for all women and girls at all levels. So, under this. So, what is a budget? It's a statement of executing the country's functioning in terms of the financial functioning. So, it starts with planning, execution, evaluation and auditing. Timing, yeah. So, gender responsive budgeting is a process, which should go alongside the planning of the state budget. If we don't start the process together, then many a times, this has happened in many state governments where we have supported in these processes, that the planning of the gender budgeting starts so late that ultimately data doesn't come, so the state budget goes without the gender annexure. So, yeah, the budget is presented by finance department. So, it has to come along with the state budget. So, it is the responsibility of the finance department. However, the mandate is normally of the social justice department or the women and child development department, whichever. There are different ways the social welfare department is nowadays structured in state, but mostly the women and child development department has to work closely along with the finance department. Having said that, we will see the document. Information has to come from each and every department. Each and every department has a mandate of gender or not? Yeah? What are you doing for gender? So, that has to come into your plan of your budget. Each department needs a budget, right? And that collation is done by finance and submitted in the assembly. So, similarly, gender budget also has to come from each department, and that is why what happens is the delay. Many departments don't send, and if you don't even have 50% of your department in the budget, how will you present that? That is not representative. 50% of your department did not even respond to the finance department's letter. Please segregate the gender budget and send along with your. So, they will make the budget requirement, but they will not put that annexure of this budget what is going for women. That additional document, if not attached, your gender budget cannot be completed. Sure. Yeah. Yeah. So, nowadays there are states who have taken out the gender budget, which is primarily, as of now, the national mandate is to give schemes which are specific for women. But yeah, so now there is also the transgender commissions that have come up in those states which have come up. They are also submitting transgender budgets. So, along with gender budget, the other budgets which are coming out specifically as annexures is child budget, the Delhi government budget, if you see, they have gender budget, transgender budget along with this. There is a yeah. If you look at SDG, the SDG is talking about women. As of now, globally, women and girls reservation, gender equality is primarily tilted towards equality, bringing about equilibrium for women and girls. Transgender is also being added into that segment of others, and so that is where governments are still so you can, yeah. So what we are saying, sex and gender is what you are defining me, that I cannot go into Darbar Shillong is my gender identity and definition. I am woman, but I don't need to be, because I am a woman, I cannot go to a Darbar, should not be, it's not ascribed. So that is where the problem is. Please understand that. Had I been women and had I had the same level of choices and equality, this would not have been required. Today, because of my gender orientation, that I have to be like this, I have to wear a sari, I cannot ride a cycle with my sari, and my family doesn't. And that is why gender budget is required, because my sexual identity should not lead to gender bias towards me. We should be saying gender because it is the societal construct which is obstructing my mobility. What? Because women have been deprived for generations, there is a huge other in terms of female.
Just a clarification. Let's look at a man and a woman. Yes, I am sure you've already had a session on sex before that. But the point is, see, even today, me being a working woman, he might be a working man. But you think I come dressed like this, I don't do anything at home. The moment I wake up, I have to take care of the household, I have to clean, I have to bathe, I have to make sure my husband gets everything, that he requires, be it breakfast. So those are all the gender norms that are already there. Why is there gender budget? Is because, like what Madam said, we have been depressed for so long. You look at the bar, we are only at the level of the executive committee. And the funny thing, the dichotomy of all of this is that at the executive committee level, they're being given droplets of funds for women, and then they were asked to do what? Women empowerment awareness programs. Yeah, women. So,
when first they were talking about gender is not equal to people.
So biologically it's sex, but gender is actually a construct that has been conditioned into us.
No, I get what you're meaning. I think you want it to be called a women's budget. Right?
Yeah.
You would say the sex budget. No, not the sex budget. You're saying
Women's budget.
instead of calling it a gender budget, let's call it a women's budget. We can't do that. I'll tell you why. The budget is not addressing women's issues. It's addressing gender norms that are causing women to be suppressed and marginalized. Also, today we'll be sharing Meghalaya made its first ever gender budget. This time, if you look at the gender budget, we're not only addressing sex, right? We're addressing gender norms, gender socially constructed customs and traditions that are putting people in the marginalization box. It's not women. I would have definitely agreed. I would have been the first one to tell the government, you're only addressing women for the women budget. But today you will see the gender budget of Punjab, Odisha. You'll see Meghalaya's first gender budget also, which was done with hardly any gender knowledge. But we are not addressing women's issues.
Yeah.
We are addressing norms.
And the whole thing is about equality. What is the SDG goal 5? SDG goal 5 is gender equality. It is not women's equality. It is gender equality. It is because there is a tilt. When this will be same, perhaps things will be different. Now they are saying that the thing is like this. So we need to bring this, and that is why we need women's reservation. We need to bring this, and that is what the whole international community is wanting to see, is how are governments trying to bring to this position and not this, and what is it being done that this is being pushed. Because like what I said, or what we have been seeing the statistic, NFHS says, anemia is high amongst women, not against amongst men. Mortality rate, mothers dying at birth is high. So for all of that to be addressed, there is malnutrition, there is school dropouts higher in the higher education among. So that is why till this does not happen, gender equality is not happening. All genders are not becoming equal, and that is why this is called as a gender equality budget, but they are saying gender budgets. Yeah, we can continue the debate at lunch.
I just want to pick two points that is MG Narega. MG Narega comes under the gender budgeting scheme, wherein it is gender neutral and it promotes both men and women to work for the welfare of their own housing. And also the recent Pradhan Mantri Yojana, Awas Yojana, it also comes under the gender budgeting scheme, wherein right of housing is also being introduced, wherein it's both gender neutral and it's allowed for their welfare.
But it is also encouraging towards women's ownership, and that's we'll come to those. So that's where you have the whole budget cycle, where it looks at the situation, then you create your own schemes, guidelines, you present to the ministry, secure a legislative approval, and then it starts getting implemented and monitored. Who are the stakeholders? Government, lawmakers, civil society organizations, citizens, and international actors. Yeah. So nothing is happening in isolation. Everything is interconnected, and we need to understand that. So the role of legislature in this is to pass the budget, examine the decisions, and the legislative scrutiny. So the 5 steps is analyze the situation, access gender responsive legislations, policies, programs, access budget allocation, monitor spending and service delivery, access outcomes. In the G20, if we look at how nations are performing, and this is the IMF International Monetary Fund, they keep a track of this. If you see India is at medium. Though the union budget has been giving a gender budget annexure since 2005, but many of the states are yet to start doing it. That is why we are still at a medium scale. So what is happening in India? In 2005, the first statement was made, and gender mainstreaming programs to improve access was put into that. What has happened because of having a gender budget is that we can see what is the allocation for women, specific programs or even part. So if we see, it's largely around 5%, and there has been sometimes higher, sometimes lower. The 2003-04 is exactly 5%, which has dipped by 2%. So what does a gender budget have? Gender budget always has two parts. It has part A, which encompasses schemes that allot 100%, like the maternity benefit. Maternity benefit will be for women only. So health department can easily put that into this statement as 100%. The other part consists of schemes that allocate at least 30% of the funds for women. So it is saying 30 to 99, whichever scheme falls within that category can also come into this annexure of gender budget. And it is seen increasingly dominated by part B. So if you see, the A is 100% allocation for women only schemes, which is this part A, and part B is, which is for both gender but have certain specific allocations for women, or the scheme is in such a way that women are benefiting. You having that understanding that women are benefiting out of it as a department. So there are certain concerns that we get in the government departments. The first is the basis on which the schemes can be included or excluded in the gender budget annexure. Like there are many times, like even the Jal Jeevan mission is not within this, and that's a huge chunk of government money that is going into this whole pipeline thing. That can also be said that women will also benefit out of it, so why is it not in there? So there are some of these debates that are still going on. It is a process that is still evolving, I must say. Schemes that earmark less than 30% of their funds to women are excluded from the gender budget. Many a times, many departments, because all departments have to give a gender budget. So a PhD will think, we don't have any women's budget, wo to health and family welfare or women and child development will have. Why should we have a women gender budget? So they don't send any scheme under this budget, and they say we don't have any gender allocation. And then allocations sometimes are unclear whether things like what was being said, PMAGY and MNREGA should come into these schemes or should come into this document or not. The lessons that have been learned from gender responsive budgeting are that the impact they have when they, government which have used this are being more productive and more specific towards such schemes. Gender budgets has to be institutionalized. It has to be brought into the system where all departments understand what it is and can give the figures. Ongoing monitoring is essential. Research and policy support is also helpful. Once you have this document, it is very, very effective in doing research and other things. So sometimes we find UNDP, UNICEF pouring in money to do these programs, but unless it is not initiated from the government and the departments, it sometimes fails. After there have been many governments who have done it for 1 year, 2 years and then stopped because UNDP or UNICEF withdrew their consultants or things like that. So again, there is a very, very important thing to note. And yeah, I think all these 3 days, all the discussions that we had is basically, especially the gender budget, is something that we owe to our children in trying to make and create this as a system which is very well institutionalized, so that in the future also this is effectively carried out. I will stop, and any questions you can take. We will do an exercise on gender budget. Before that, if there is anything.
First step that needs to be done, correct me if I'm wrong,
Sure.
is that while the preparation of the budget happens, so they also it also contains the annexure of the gender budget, which gets sent to finance department. Now then, it is the finance department who collates this data received, and based on that, they make the gender budget, right?
Yeah.
So, which means that it depends upon the services and the schemes that are available with those various departments on how they allocate the budget accordingly.
Yeah.
So that in turn would mean that we would have to train people from the finance department, planning, and many other departments that we have, so that they will all understand from the gender perspective and gender lens.
Yeah.
Is that correct?
That's how. Because also, I'm not sure, Meghalaya, are you also reporting against the SDGs? Yeah. So again, we also start looking at, if you are saying this scheme's objective is what, and which SDG does it fit into, because the government has to start is reporting on SDG. So then you see that link of the money allocated, the scheme, the objective, and the SDG. That's how you see the whole flow, or the vice versa. Normally the vice versa does not happen, actually it should have been that way, but normally this is how when we do the gender budgeting thing, is that we look at the scheme, and sometimes scheme could be as simple as even having a creche in the office, or doing special training programs like these of gender training programs within your, that 20,000 rupees that you spend on the training budget, also you can just write it as your gender expenditure for the year. Even for your department, could be for your, so whatever you have spent is something you can report or you can ask for. So even these training budgets can be, because it's a budget of the government, it's the money of the state which is getting spent for this. So, sorry. So the scheme, then you look at the objective of the scheme or the allocation, then you look at the objective, then you see whether it is falling towards gender equality, and then you see which SDG it falls, so it falls under SDG 5. For any scheme, we try to look at it from this lens. So like MNREGA says, I think there also 33% is allocated for women workers. They are also there. So yeah, it's a part and parcel of the program, and because it is that is why now it is being placed under gender budget as an annex. So just recognizing that we are doing these and this needs to be moved here, just put that in a document and send. A lot of times it has been made, gender budgets have been also in between hyped a lot and made it felt so technical that people felt aversive, and many states have not been doing it because of that. So it's very important to simplify, because even for departments, every department has been doing the state budget ke liye, sending their requirements for ages. There's nothing new, you just need to cull that out and place it and give it. Rest of the graphics the finance department will do, of making pie charts and bar charts and explaining as a whole how much is being spent and other things. That is a different thing altogether, but otherwise for departments just doing this is enough. Yeah, the PWD Act is also, but as of now, again, there are these push which comes internationally. SDG 5 is specifying about gender budgets. But if you look at, I think, reducing inequality, that is, reducing inequality is SDG 10, goal 10. In that, I think there is a requirement to tell what is the expenditure. But what happens is, again, PWD Act talks about education, health, everything is there. But then how do you allocate resources specific for children with disabilities is still something not happening. How do you say that within the health, normal health and specific persons with disabilities health, how is it? Maternal health is quite specific, but this is a little, so that is why as of now, there has been no requirements of providing such an annexure of disability specific budget. The trans budget, but under gender, many state governments are putting, and we should advocate for it. You are very, very true in that. So we have to move things out, and that's why states are moving. Yeah. You don't make allocations for each and every. Yeah. Very true. Has a transgender commission come up in Meghalaya? Not yet. Yeah. So this is something which the community needs to advocate for. We have done it in Assam, and today we have the Assam commission. Yeah. So yeah. So that depends. Like when the commission itself has an expense, staffing, everything, that will become an expenditure in the budget. Then they have trans-specific homes for transgender in Assam. That has a cost for the government. That has come in. There is a whole legal cell unit which provides support to LGBTQI plus community. That is a budget allocation which has come in. There are specific schemes which are coming out for LGBTQI plus community. That is coming. So that is not something which we do now, because that's when the community numbers increase. Now what is the number? See, any scheme or a government or international responds based on data and numbers, right? The data will push you, the government, to make a scheme. Why does the government make a policy? To please its voters. Clear cut baat hai, right? The voter, so is the voting community large enough of LGBTQI plus community to put pressure in terms of addressing all of that needs? As of now, it is not. That is why it is not even going. As an international setup, the numbers are enough to, start advocating, and each individual counts. But again, like what we said in the first day, we don't even see the presence of the trans community within Shillong, or we're not acknowledging it as of here. So, because perhaps Assam has a larger population and who have come up in open and are starting to demand. That's why the commission has come up today. There are homes which are allocated for transgender communities. Perhaps that will also happen in Meghalaya someday. So it is an evolving process, and what you are saying is very true. That will also maybe be a day when we'll have a discussion on that. Yeah, that is how it is evolving. Because each community, and I'm saying all these are also the disability community, the LGBTQI community, each community, has a right to participate, has a right to contribute, and as those things evolve, we will have to accommodate all of that as institutions and governments, because everyone's rights have to be, choices have to be. You need to demand for that. Okay.
Budget is already there and it is already presented. Okay, now gender budget, this was the first year.
Now, when it comes to the trans, and I'm sure the legislation has just come to function in the next 2-3 years. See that. Now, the question was, how do we do it? Well, we have to keep training ourselves to do it because we are going to have to provide. These are policy documents that no government can say they're not going to. Right? Because international conventions and standards hold you accountable as a state to provide it. Now, Meghalaya has finally provided the gender budget. Disability was taken care long time ago, because now social welfare has been
separate department
and disability can have their commissioner and commission. So when it comes to the trans, I think Meghalaya is getting there. Come up with the legislation, and very soon I'm sure even the trans budget, for me trans would fall within the gender bracket, the gender within the gender activities, and should fall into the gender. It should not be
some states are doing within gender, some are presenting separately, but most are doing within gender.
I believe it should be a gender identity.
Under the gender budget, there is this scheme known as the Skills Meghalaya, where more than 10,000 youths will be trained and they'll be given training. Because right now the government actually suffers from it's always one of the poorest states. So Meghalaya is actually fighting for that to come out from that. So that is the reason under this new budget it is focusing more on to help the poor come up first. There is this recent mental health policy also that's been framed, wherein people from various parts areas, transgenders, everyone, they have the right to have a say. They have been accommodated in various mental hospitals. They have given proper sensitization trainings. So it's like a first step. We will go on forward with gradual shifts. It's like a
so we will look at 3 state gender budgets in comparison also to, not comparison, but also looking at the Meghalaya budget, looking at that. So we'll just divide ourselves 1, 2, 3, we'll count off into 3 groups. We'll look at it, and then post lunch we'll do the presentations. So we'll count off 1, 2, 3, 1, 2, 2. Huh? No, you were 2, 3, 1, 2, 3, 1, 2, 3. So what? You are 3. So what we'll do is each group will get 2 budgets, one of Meghalaya, one of any other state. Yeah. So the both the budgets, you look at them and especially look at the number of departments that have contributed to this document. You don't have to list the names, but the number of departments that have contributed, the number of schemes that have been listed in the document, and anything else in terms of the presentation of the 2 documents that you want to comment on. Like the contents of it, how they have presented the contents. If there is anything that you want to talk about that, you can talk about that. And clear? Number of departments, number of schemes. So you just need to count off the number of departments, count off the number of schemes, and talk about the way the data has been presented. And then if there are also any questions on that, you can ask. So first, read it as a group, and then we'll do the presentations post lunch. So can we just divide into the groups and then maybe break for lunch, come back, take some time to review it, and then present it. So if you can get into our group, then I will hand over the documents. So we have 3 states, one from Tripura, one from Odisha, and one from Punjab. And these 3 states have been one of the earlier states which have started presenting gender budgets, almost around 2005 to 2010 they started doing this. So, group 1, can we come together, decide? Group 2 can be here, group 3 can be there, or whichever way you wish to sit.
Gender budgeting of 2 states of Meghalaya and Odisha. So first of all, we are being told to list the number of departments. For example, for Meghalaya, we have 70 number of departments, and also being told to list the number of schemes. And in Odisha, we have, after looking at the budget book, we see that there are 38 number of departments in Odisha. So in Meghalaya, out of the 70 number of departments, 5 of the departments, they have highest allocation regarding the gender specific allocations. So the 5 departments are education, health and family welfare, community and rural development, planning, and the last one is social welfare. Now when it comes to the schemes, under the Meghalaya budget, we have 4 state schemes which are gender specific. There's a gender specific allocation, and 6 central schemes implemented by states. So the state schemes having a gender specific allocation, there are CM Safe Motherhood schemes, Mother App, CM Scares, and Focus. And while we go through when we went through the budget of Meghalaya budget, we saw that there are 2 parts, Part A and Part B. Then Part A, I would say, I think maybe there's a 100% allocation for gender allocation schemes, and Part B is regarding the 30% allocation. So 10 departments have 100% allocation, 4 departments have 30% allocation. And these are divided among 5 departments, So that's done with the Meghalaya part. We have to come to the Odisha part. Since Odisha is a much bigger state with a much bigger budget, so we have more departments. So under it, again, there's a division between the number of allocation when it comes to gender specific schemes, 100% and 30%. 15% departments, they have 100% allocation, and 35 departments, there's a 30% allocation. So that's it. That's it.
Anything else on presentation that you want to talk about?
Regarding this, I think that's
Yeah,
it.
both the states.
No, that's it, sir.
I think Odisha is way ahead so we still have a long way to go.
They were actually the first state in India to start gender budgeting. That is Odisha. They have, that's why
concentration is
that's why all departments are oriented and everything. Great.
So we got Meghalaya and Punjab, and Meghalaya it's 17, but in the summary it's 18. So I don't know whether it's 17 or 18 now. We found out that flaw. Number of schemes, Part A 55, Part B 195, and then the schemes are presented, Part A 100% for women and Part B like partially. And the departments, they are identified in grant codes, because we were looking, because in Punjab, they specified the departments and the schemes. But in Meghalaya, we couldn't find. So then after some time, second reading, we found that the grant codes are for the departments. So it took us a second and third reading to find that out. Whereas for the Punjab one, it was like clear cut. Just first reading itself, you know that this scheme is for this department. Okay, then for example, see, grant code 21 is education. And then we have grant code 26 is for health. And the rest also they have codes, grant codes. And then Punjab, number of departments is 4, specifically for women. But in Meghalaya, these are not specific women departments. They're health, education, social welfare. So these are specific. The number of schemes in Part A, gender specific, 28. Part B, gender specific, 30. Part B not gender specific. This will be 30 to 90% represent. It's 35. And then Part C, 30%, 7. So this is the same. Part A, all gender specific, 100%. Part B, 30 to 90. And Part C, 30, under 30. So the difference is, when you read these two, this is more clear, Punjab, for a layman. But if you go in depth, this is detailed.
But in Punjab, only 4 departments are.
That's what they mentioned in only 4.
Gender specific.
So there's no health. They had Department of Social Security.
Not even in Part B.
Not even in Part B. So even Part B, they had these 4 departments. Department of Social Security and Development of Women and Children, Department of Social Justice, Empowerment of Minorities, Department of Rural Development and Panchayat, Department of Urban. But where is education, where is health, where is social welfare, we don't know.
Yeah.
And Meghalaya, we have all that.
Yeah, many more departments. While they are presenting it better, but perhaps department-wise, the coverage is so limited.
Department-wise, gender-specific budgeting, we are more, that's what, jokingly we were saying, we are over-reporting.
Yeah, you started now, but covered a lot of departments.
We've covered a lot.
They have been doing for some time now.
They have Punjab has limited their schemes
just
to only
because
the
other departments are not even seeing gender or perhaps understanding gender for that matter.
I think so. Yeah. No reporting at all.
But then the progress report goes that this state is spending less on gender, is what internationally the figures will go. So which is not a very good picture for the state.
It's got quite a number of schemes, but they did have under department, some other department, one of these departments, they did have scholarship schemes which are for under education. Like quite a number of scholarship schemes which in Meghalaya will be under education. So clarity is there at the beginning, but then when you delve deep, there's no clarity. So here, a second reading, you get like everything is clear, but here the first reading, everything is clear, second reading, nothing is clear.
Yeah. And it also gives an impression of the state as to what would be the situation.
This is good. Yeah. This is advanced.
When you start looking at
but when you in depth,
just 4 departments is quite striking in itself. There we had 38 departments. Here it comes down to 4 departments.
4, and they've taken from all other departments, clubbed them together
under one.
Yeah.
Thank you.
Thank you.
So we got a comparison of Tripura and Meghalaya. So in Tripura, we have the number of departments are 18. The number of schemes are 35. Provision for gender budget is a yes. And they have even given the numbers. How much is in terms of gender budget is given. So in the first year is 34% and they have increased to 41%. The departments are decentralized in Tripura. So for example, when you talk about, when you say education department, you don't have an education department. They have a higher education department, an elementary education department, then they have a, I'm sorry, I have to refer to this, secondary education department. Then they also have social education and social welfare. So now there is a duplication in some of the schemes. There's a duplication now being done by social welfare and by, because they don't have a social welfare department, so there is a duplication of schemes. Though they have the departments are decentralized, there's duplication of work. So there are some of the schemes are overlapping also. So sometimes you can take from one department or you can take from another department, and sometimes they both do it. So there is duplication of work. In Meghalaya, we have 17 departments.
This 34, and it has been raised. All departments are having a similar pattern, or overall is the
This is the overall.
Overall.
Though they have given a separate for every department, they have given a thing. So I'm just giving the overall.
Also, but this is the overall.
The overall. In Meghalaya, we have 17 departments, but these 17 departments are centralized, and so the number of schemes also are higher, because now under these departments we have different subsections. So, like for example, we have a department of education, we have higher and technical education, elementary education, and the other programs also. So these that's why they have higher number of schemes. If provision for gender budgeting, though it says here, but then they have not been able to give at a departmental level. And if you look at the numbers, if you look at part A and part B, they're just given so and so amount. If you look at page number 5, just say so and so amount has been given for gender budgeting, but where is it allocated? It's not being clearly described. So the gender budget in Meghalaya is not clear. One look, even you have to delve deep, and then even then also it's not easy. But whereas in Tripura, every department, how much allocation is being given for gender budgeting is already given at one look.
Just one point here: in Odisha and in Punjab, they have given the scheme's total budget, right? Have they also given how much is specified for gender within that scheme in the schedule? How much is for the gender that is specified? That's the total, but in the schedules for the departments, are they giving, or that's the over? The heading, if we see, no, no, this is fine. So, if you can just show the Tripura one once.
So this is provision for gender budget.
So in Tripura, they are giving the total budget, and then they are saying within the total budget what is for gender specific. They are even giving that amount specifically. But here, if you see, Odisha also gives the total scheme budget as the total gender thing. Here they are bifurcating. While even Punjab gives the total, Meghalaya gives, most states give the total. Some states go even deeper of within that scheme. Suppose 100 crores is allocated. So then they are in Tripura, they are also saying within the 100 crore, how much is for that thing, which most states don't do. Most states give just the total fee of that scheme.
So the departments are centralized in the state of Meghalaya, and but the various schemes are compartmentalized. So even when you say education department, they'll have several schemes of the higher and technical education. They'll have several schemes of the secondary education. So that's why we have higher number of schemes. And there's a clear-cut distinction of which scheme, and there's no overlapping or duplication of efforts.
Any questions? So now gender budget is clear, and like it is seen in the group work, each state has its own style of doing it, and I think like I said earlier also, it's an evolving process which is going on, and each state is trying to standardize and increase its reach in terms of bringing in schemes, but yet there is a lot of clarity still required as to which schemes to put there or not to put. Even in the finance department or even with department officials, there are still a lot of non-clarity, and perhaps some of it will continue to remain. But I think we should appreciate even Meghalaya government as the first budget document. It's quite a good standard document, and I think it has been very, very well laid out presentation wise, and also in terms of the allocations that have been made by each of the departments. I think the thought process is really, really commendable, and this will go a long way. For the state, especially, work was anyway happening, especially in terms of the representation of the state's work at the national and the international. With that, we close the session, and thank you very much for the contributions. We have one last thing which Joy will lead us through.
Okay, so before we close our 3-day training, since we, have spent so much time in understanding gender, understanding budgeting, we have to take away something to, our own departments, right? It's very important that, okay, some kind of initiatives or some change, we try even at our own level. So I'll be giving everybody some paper, and everyone can sit like department wise, even if you're alone, and just for you to, it's just an exercise to brainstorm as to what do you think you could do going back from this training, or even if there's any kind of assistance that you feel that you require, certain things you want to do but you're not sure how to get it done, you want to ask for some assistance. It could be from the government, it could be from our partners and stakeholders. So what exactly do you need so that we can take that back and present that, and at least that will be a step towards some change. Okay?
Even within the schemes and programs or any form of work that you are already engaged in within that.
So how many departments do we have?
We can break them into groups and start the quiz. We have some more there. Break them into groups.
Okay. Is everybody sitting there department-wise? No. Yes? No, Kong and Sir, no? So we can take around 10 minutes for what action do we have in our own department that we want, and then we'll just present that and then break the tea. Okay?
So after this 3 days training, I actually think that we can do this, we can bring this to our office. The first one is we need to establish an internal committee within the Women's Commission. And the second is we need to bring scheme within the commission,
Okay, so
like
first
divorce
we'll
and
have,
livelihood.
from
Actually,
Women's
there is no
Commission.
scheme in the commission. So the third one is awareness program at rural area, because like we always have programs in the urban area, which almost all of us, like we have some knowledge about everything, no? So we have to focus in the rural area. Training for staff on the gender within the office itself. And we need to make a proper provision for women. Actually, right now, for single mother, we get only 750. So this one also should be done. Yeah, so thank you.
Throughout these 3 days training, we have learned so much, and the following are the suggestions that we have from our planning department. As such training program to be conducted for the other officers and staff of planning department. And number 2, such type of training program is also required to organize at the planning office, that is in the district level. And number 3, setting up of internal committee of sexual harassment in workplace in the office if not constituted.
Okay, thank you.
That's all.
I think when you go back to office tomorrow, just ask once if this IC is there. Yes, it'll be good. Mm-hmm. Can we have time to check?
Okay, we are from Director of School Education Literacy. So the first instance, when we go to resume our office tomorrow, we would like to request our concerned officers to organize a meeting and form an internal committee in this connection only. And in this regard, we would request all the officers of the education department to conduct such kind of training program in all the districts and sub-districts, so that subsequently they can organize a training program in their respective school under their jurisdiction, creating awareness for the teachers and especially children. Oh, sorry.
They won't leave. Shubha nang niba.
First of all, I would just like to say on behalf of the whole team that we're thankful for this training. And the most important thing that when we go back is we look forward to the formation of a committee against sexual harassment of women at workplace, because I feel that's really important. Though
You could also make a gender neutral policy, by the way. There are organizations, departments, education institutions who have made a gender neutral policy. And I think that is.
Okay, I think that's all.
Oh, okay. Your commission has more than 10 now.
No, we're less. 8 to 9.
But then you have,
Still less, that's all.
Department BRT, Educational Research and Training. So point number 1 is setting up of sexual harassment committee, and awareness of what action falls under sexual harassment at workplace. Next, awareness about gender, and the last is training on gender budgeting.
Okay, this is a summary of what we learned what we observe, and I think some suggestions. I think one suggestion is good. So this is from the views of department. What we learn is there's a difference between sex and gender, and number two is the intersectionality of gender with other social identities. That is very important. Example is that old woman who has to take care of her parents in the village. So that one is very important. Intersectionality of gender with other social identities. Number three is this triangle, patriarchy triangle. How often people in power misuse it, be it male or female. Just because it's patriarchy doesn't mean that it's only male. This one, fourth point is the difference between equality and equity. Fifth is gender equality action framework, that exercise that we learned yesterday, and the case study, which is very interesting, is that women cycle time. So we learn a lot from that.
And actually, when it comes to this part, this gender equality action framework, I think for my opinion is that what we're having in this class, it comes in the second quadrant. It's individual, and it's an informal one. Because if the audience is officers and politicians, I think will be under this part, is formal part. It will be individual part, but it will be the formal part. Means there will be some, maybe they will think about it when you go home, and they will think about maybe loss. So what can we do is that, first of all, as per our department, is that see, the thing is that because of inequality and or perceive or the reality is that there are so many consequences which arises from it. One of them is sexual harassment, then domestic violence, and also there's a domestic violence against women and girls, especially the vulnerable ones. So what can we do is that we can raise awareness regarding equality, because that's the thing, that's what we are targeting as, to have gender equality, to be in equal footing. And second of all is that what we can do is, in the department, is that we can be sensible to the needs of different genders in different scenarios. Example is that we have so many friends from Garo Hills that works in Meghalaya, so they'll be living far away from where they're posted. For example, they're living, let's say, around to villages part, and so what we can do is that we can give them some kind of accommodation, so that, because we're working under police department, so sometimes we have to work late. That's one of the things that we have to do. So as men, we can go out. Means it's not a problem, but for women, it takes strength for them to actually go out at night. So what we can do is that we can provide them some kind of accommodation, like buses or accommodations or rents nearby where they're posted. And to get to this part, I think it can relate it to gender budgeting. There can be some subsidies. There's a policy where we can get some resources, some money, so that these buses can be there for them.
And just to add to what I think is so important in the home and in the police department is also that we need to have more women in the police force. So I think, Meghalaya still has one of the lower in terms when it comes to number of women police officers. So maybe that if we do more with gender training and more understanding of that, if we have more women police officers, that also will help to crimes against women.
And also, I think one of the when it comes to gender budgeting, okay, like there is some funds that's allotted for women, but there's no specified head. I can say that it's under some kind of head. Like when it comes to budget, there's different head of accounts, heads of accounts. So because in SF10 there's now we have inducted women's commandos, Mega Secti. So but then the budget provisions is under a head which is not really specified for them. So that's the thing. So there is, but it's not specified for them. So I think so that if there's a gender budgeting, which means will be like there will be budget provisions specifically for women, then yes, my comment is.
So we come to the end of the 3 days, and it's like 3 days seem to be quite long, but I think the journey was really wonderful, because when we started, we were a small team on the first day, but I think the kind of interactions that we had and also the kind of responses that all of you gave has really made these 3 days a learning experience for us also, and more so because of the state's way of functioning and systems which exist are slightly different from most of the other states in the country, and that's where it gets far more enriching to understand. And I think all of us had this wonderful experience of looking at things, because gender is something we all have been hearing about, learning about, but looking at things maybe a little differently, hearing each other's perspectives and sharings. Thank you very much for giving your time and your active participation. Really enjoyed being a part of these 3 days.